Hi, I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Tuberculosis is a major public health issue that affects around 10 million people worldwide each year. Despite being preventable and treatable, TB still claims the lives of 1.5 million people annually, making it the deadliest infectious disease globally. While the effects of TB on the respiratory system are well documented, the relationship between tuberculosis and infertility is not widely known. Let's try to understand tuberculosis and its effects. TB is commonly associated with the respiratory problems. However, it is important to understand that it can also affect other parts of the body, including the reproductive system. Both male and female fertility can be affected by tuberculosis, but the mechanism and consequences will depend on whether the individual is a male or a female. Let's see how it affects female fertility. For women, tuberculosis-related infertility can be particularly distressing. The infection can spread to reproductive organs, causing inflammation and scarring. Now, because of this, the delicate balance required for conception is disrupted. Let's look at the kinds of tuberculosis that a woman can have. Pelvic tuberculosis. TB can affect the female reproductive organs, leading to pelvic tuberculosis. This occurs when the bacteria responsible for TB, which is Mycobacterium tuberculosis, affects the fallopian tubes, uterus and ovaries. It could cause tubal damage. This is the most common way TB affects female fertility. Tuberculosis can lead to inflammation, scarring, blockage of the fallopian tubes. This can prevent eggs from traveling from the ovary to the uterus or interfere with fertilization. TB can also cause menstrual irregularities. In some cases, TB may disrupt menstrual cycle due to its impact on the endometrium, making it difficult for women to conceive. Let's look at how TB can affect male fertility. TB can affect male reproductive organs also, leading to conditions like epididymitis or orchitis. These conditions can interfere with sperm production and functions, reducing fertility. Tuberculosis can also infect testis, epididymis and prostate gland. Basically, these are organs in the reproductive system, primarily through genital TB. It can lead to epididymal obstruction, preventing the passage of sperm from the testis to the urethra, resulting in male infertility. This can also reduce the quality of sperms in terms of the number and the motility, decreasing the likelihood of successful fertilization and creation of embryos. So how do we tackle TB? How can you cope with tuberculosis? Couples who are grappling with infertility due to tuberculosis often face a number of challenges. There could be stigma and isolation. There could have emotional impact. It could also lead to financial strain because of all the treatment options. Both male and females can be affected by TB, as I said, and the severity and impact on fertility can vary depending on factors such as extent and duration of the infection, as well as the body's response to treatment. It's very important to understand that appropriate medical treatment and management can often reverse TB-related infertility. TB can also cause systemic effects on the body such as weight loss, overall debilitation, which can indirectly affect fertility in both men and women. So to reduce the risk of TB, early detection and treatment is very critical. Timely diagnosis and treatment of TB are very critical, and this treatment can be given over a period of 6 to 9 months depending on the extent of tuberculosis, but definitely it has to be done under the supervision of a physician only. Education and awareness is very critical about the disease also, because misunderstanding this disease could lead to no treatment or severity in the problem. If you wish to understand more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.